What we're trying to do is work out what a really good cancer rehabilitation service looks like. And today I'm really excited because we have got a whole room of patients who are telling us what matters to them about their rehab services, and what's gone well, what hasn't gone so well, and what a 5-star service to them would look like. And I've been in cancer rehabilitation for many years, and yet these guys are the real experts, and they know what's important to them. And we're starting this project with the patient voice, so the patients are at the heart of what we're doing, and I'm really excited and already learning loads about what they're saying, and I'm hoping that as a result of today we can make cancer rehabilitation services in London better.
What I loved most about my dietitian was actually having that service. She was really, really easy to talk to, somebody who gave me a bit of focus about what I should be doing with my diet. I think was really important, and having that support.
The regular treatment by the speech therapist, they try to make sure that I'm well catered for most of the time. Not only that, the supplier of all the materials we use, they keep phoning me most of the time to ask me if there's anything that I lack. So I have to quickly look at my materials and see how I can update them. But most of the time, they are always ready to assist me.
What I have valued most about accessing rehabilitation services after treatment has been support and understanding.
And it was only then by talking on the telephone, which I was lucky because I know some people in my position didn't even have access to that service. And then things began to improve from that point on. But by and large, they want to get you out of hospital as soon as possible, and that's understandable. They need the beds, surgeons and so on need to move on, and the medical team needs to move on. But I found at the time, this was about 4 years ago, there was very little support afterwards.
In a nutshell, when one is diagnosed with cancer, it's a massive shock, and you are then put onto a big roller coaster where lots of things happen to you and you have absolutely no control. We're very good at diagnosis and treatment, but what we're not good at is then supporting people into recovery and survivorship from cancer. And this is where it is absolutely crucial that the rehabilitation services are available and are part of a personal plan for people to help with their recovery from cancer.
But I think in hindsight, knowing that the service is there and that it's easily accessible, and I think from having been close to quite a few family and friends that have also experienced it, they weren't really aware either that the service was there, so I think that's quite key to people like me.
What matters most is that people are actually able to access the services and know where to access the services and what is available to them, and that currently is not an experience that everyone has. I do wish that had actually all been discussed with me at the point of diagnosis. It may be something that actually is difficult to take in, but I think I would have felt much more supported to know that there was going to be aftercare once I'd been through my treatment.
What matters most to me and to other laryngectomy people is to have our speech quality improved. Like I said, some people when they talk, we hardly understand them. It's either they are whispering or not. But we want to improve the quality of our speech so that, well, as much as possible, those of us who are in one profession or the other can carry on with that profession as much as possible. This speech therapy is the main focus after the surgery. It appears that most of us laryngectomy survivors, we are left to the care of the speech therapist. They are the people who do the management for years.
But also the physical aspects, because I was very weak when I came out. I suffered from a lot of muscle atrophy and also bone density as well. So I'm a member of the Esophageal Cancer Patients Association. So you talk to people that have gone through similar experiences to you. But of course within that, each symptoms are different.
And I think there's a breakdown in communication maybe between patients and our doctors as well, not knowing that we've gone through the process, we've had the treatment, and then bye.
It wasn't easy to access those services, and it wasn't part of my treatment plan. I actually went out and found those services for myself.
But I found at the time there was very little support afterwards, particularly discharging between information that's given from the hospital to the GP.
I actually wish I had known that the rehab service actually existed, that there were, the service was available to people like me.
What I wish I had known was how much help there was actually available to me. There are a significant number of services that you can access, and they make a huge difference to the quality of life that you have and to how quickly you actually recover from your treatment.
I wish I'd known what services were actually available, and I wish I'd gone actually to a seminar or a focus group prior to the surgery and prior to the chemo. Now, the Esophageal Patients Association, I went to one of their groups, and that was very good for me, because I saw people that had been through a similar thing that I was about to go through, not quite the same as it turned out, but they looked very healthy and so on, and that was very reassuring and reduced the anxiety that I had. And also, when you first come out of hospital, it's very difficult, because when you've had a lot of invasive surgery that I had, I was in intensive care for five or 6 days, and you are extremely weak, and the only thing you want to do at home is get home and you lie on the settee and watch TV or do nothing. And so the plan needs to take the individual circumstance, and it needs to be timely, and also it needs to be over quite a longish period of time as well, because the symptoms don't go away. So you could say, okay, you could have an integrated care plan over 6 months, that would be fine, but you need access to these services over a longer period of time. I wish I'd have known a bit more about what the effect was actually going to be for me, and what I would need to do about it. For the family, as well as for the patient, and I think that is very important, because the family needs support. You go there, you're the centre of attention, things have been done to you, you try your best and so on, but it's very difficult for your family and your friends and the loved ones and so on. And I think in some ways it's harder for them than it is for you. You steel yourself and you go through it, and you're determined to come out of it the best way you can, or just accept that you may not come out of it. But if you're family and friends, that's difficult. So you need to get that support for them on an ongoing basis as well.
Something that was actually integrated into the chemo, something that could have taken place alongside my chemo, because that's when I had a lot of the physical side effects, would have been amazing. And then for that to follow on, maybe anywhere between 2 to 5 years, I think is realistic, because I don't think it really hits you until you've come out of the system, so to put it, until about a year after treatment's ended. So it's really important to have that going on long term.
For me, a 5-star rehab service would be a service that has a holistic approach. So it works as a joined up service with the initial treatment, so that everything actually works together, because post-treatment there is a lot of rehabilitation that needs to happen. So a good service would be one that actually builds that into the patient's treatment plan initially, so that it's not something that you actually have to go and find and access afterwards. It should be part of your treatment. The key is for all the services to be joined up. There needs to be communication between each of the different services to ensure that the patient recovery path happens smoothly and they get access to everything that they need. I do wish that that had actually all been discussed with me at the point of diagnosis, and this is where it's absolutely crucial that the rehabilitation services are available and are part of a personal plan for people to help with their recovery from cancer. The key is for all the services to be joined up. There needs to be communication between each of the different services to ensure that the patient recovery path happens smoothly and they get access to everything that they need.